extract all remaining teeth or save some? It is a question to be answered. A lot of our patients are going for multiple consultations in order to find out what will be the best of restorative options and surgical option in the situation where the whole mouth has to be rehabilitated. And we are very happy to see that they are looking for second, third, and fourth opinion. And we are having a lot of patients coming in with that questions. It's very common. So I'm going to present one of our dear patients and how we solved the situation. Here's our patient presenting for a full mouth rehabilitation. He has been a motorcycle rider. He has been involved with a lot of sports activities. Of course, throughout the years, a couple of accidents, fractured teeth. He is presenting for a comprehensive treatment plan. And this is what we usually do when we have many areas of concern. We have multiple appointments with our patients discussing what treatment options are available for them. So in this situation, we have collapse occlusion. That means the bite, it's closed. Teeth are colliding into each other. We have loss of posterior support. Many of the back teeth have been fractured or lost over time. We have ill-fitting restorations. As you can see right here, one of the crown has been retrofitted and re-cemented. We have fractured teeth. We have failing root canals and periodontally involved teeth. Our patient presents with pain, discomfort, and inability to chew, and we have to find the best option that it is available to him. With the concern, if we can save some natural teeth, we will do. So it's very usual. In those situations, we take records. We are analyzing from an intraoral and extraoral perspective. We take radiographs. We definitely see that we have supereruptions. We have anterior splaying of the existing dentition. We have uneven occlusal plane and loss of occlusal vertical dimension. That means the bite is closed. Some of the teeth are shifted away. We cannot, majority of those teeth we cannot save, especially in the upper arch. So we explain our patients that we have to do a diagnostic workup, which is diagnostic wax pattern. And with the way we do it today, we do it digitally. So we import all the data into a software, and we are expecting to analyze the tooth position within the arch. So this is what we did for our patient here. We arranged an ideal smile, a digital smile design. We open up the bite. We create all this diagnostic wax pattern into a different bite dimension, which will be the appropriate dimension or proposed appropriate dimension. So we came up with the idea that within the parameters of this information that we have, we can probably add a couple of more implants on the maxillary arch. We already have one in the anterior crown. And for the lower jaw, we probably should extract some of the back teeth and maintain the anterior front teeth. So this is what we did. We had this proposal, and with this idea in mind, we had the surgery. So we removed all the maxillary teeth. We placed a couple of more implants anterior to the maxillary sinus. The desire of this patient was not to graft the maxillary sinus. So we were able to place a couple of more implants anterior to the sinus. We ended up with approximately 7 maxillary implants. For the lower jaw, the remaining natural dentition presented very, very healthy. So we decided to preserve at least 8 of his natural teeth. The posterior support was completely relying on the implant restorations. So what did we do? We designed provisional crowns, natural teeth, and implants, and we combined the two. We allowed our patient to experience aesthetic function and health, removing all the fractured teeth, grafting, placing implants, and wearing prototypes at the desired vertical dimension and at the desired smile. So, of course, we work with our patients. We love to have their input. We like to accommodate a beautiful shade of the teeth, so we select a very natural shade for their smile. And once we have all this information, healthy teeth, healthy gums, healthy implants, a beautiful smile, a comfortable jaw position, and a good masticatory function, all this together, we are moving into the software again. We analyze it again. We make sure that we have all golden proportions and all the desired features of this new smile under control. And then we import it in the software, and then we prepare for the final restoration. So for the upper jaw, there's 1 implant bridge. For the lower jaw, we have 2 implant crowns on each side. As you can see from this rear view, we have custom abutments on the left, custom abutments on the right, splinted crowns. We like to splint the implants in the lower jaw and the posterior areas because it gives the patient much more comfort, security, and confidence for biting down in hard food. Everybody wants to enjoy as much a variety of food. We should not have any restrictions once everything is healed and ready to go. So the laboratory technician prepares 1-piece maxillary arch. We like to call it cross arch stabilization, where all the upper implants are splinted and work as one. Either digital or functional traditional workflow. As you can see right here, we for this patient situation, we had created our traditional workflow with stone cast. We mount the stone cast, we verify this information, make sure that the bite is well aligned, and then we place the final restorations. And we take a final radiograph to make sure that we have a good baseline where all the bone levels are healthy and all the teeth contours and bite is healthy. Following that, we are instructing our patients on how to take care of those crowns. There is multiple ways, multiple use of water pick, interproximal brushes, of course, super floss, and many other small devices that allow the gum tissue to be maintained healthy. And of course, enjoying with all our team together, a beautiful patient, beautiful smile. Everybody's happy, and ultimately this is always our goal, to make our patients happy and to achieve a very good result. Thanks for watching. See you next time.